where do we see the foundations of the social and community welfare provision being started and how it started in the UK. So let me just quickly press record and then we'll make a quick start. Where do we see the foundation? So in today's session, obviously for those of you who have joined, thank you for joining. We're looking at learning outcome 2 today, and that would be focused on development of social and welfare community provision. So here we are essentially going to focus today on looking at, understanding where and how are the beginnings of social and welfare community provision, happen. So in this case, we will go into the timeline, and these timeline, essentially would be looking into going back into history of who was the health secretary then, what changes were introduced, what acts were brought in, and obviously how did it help in setting up what we get to see in present and modern day as social and welfare community provision, which is provided through the National Health Service, and what are the various agencies which are involved, and what are the key milestones which were which have led to this particular present day system. And there are two assessment criteria in this outcome. So one is defining the key milestones. So we look at a table which will go through some of the key years in which we had these significant changes which were introduced, and they all led to the creation of the system that we get to see being delivered by the National Health Service. And then what we'll do is we'll compare and contrast. And here what we want to do is basically have the understanding of how the system works today vis-a-vis the system, how it used to work in the previous year. So here we are looking at, when I talk about previous years, we'll be looking at eras. So we'll be looking at the Elizabethan era, which is from 1601 onwards, this 16th century onwards. Then we look at 19th century, then 1950s, then we look at 2000. So we'll divide this into 4 broad eras, wherein we'll compare and contrast how the provision for these health and social care services were during that time and how things have evolved over the years, and then what is the current state of the current system which is available today. So these 2 criteria is what we are looking at discussing in our discussions for learning outcome 2. So let me just switch over. Now, one of the things which I would mention, obviously, in going through this particular unit, what you'll be realizing and seeing is that there's a bit of reading that you have to do. And the reading that you have to do is based on the fact that when some of you, I hope, have looked at that handout which I'd mentioned yesterday for learning outcome 1. And that handout, if you look at, had 4 or 5 major reports, which I suggested that you would need to be familiar with when you look at, essentially reading this particular unit. And these 4 reports, that I mentioned primarily were, let's start with the Griffith report, which is the one which basically brought in all the major acts that we see after World War II. So 1944, 1942, 1944 onwards. Then we look at the Marmot Review. Then we also look at the Lord Darzy's report. And then the 4th one, so I think there were 4 in particular that I referred. Let me just quickly bring that out for the benefit of everyone. So those 4 that I refer to are the ones that you have to read and go through, even on Moodle. So what I've done is I provided these 4 as PDFs so that you're aware that, these are the bits that you have to look at. So it's the Beveridge report of 1948. We have the Griffiths report of 1986. We have Lord Darzy's, review of 2008, and then the Marmot review of 2010. So these 4, if I somewhere pin it down in terms of 4 important that you need to be reading to understand how the NHS was formed. What are the steps or changes or policy initiatives which were taken by the government, which essentially allowed us to have a social welfare and a mental health and well-being system in the UK, which is all services currently delivered by the NHS. So these are four important reports that we need to look at. Now, before we go into learning outcome 2 and discuss some of the bits, what I want to do is show you where these are on the learning outcome 2 slides as well. But obviously, detailing of these, some part of it have taken in straight away from the reports. And my suggestion, as I mentioned to you earlier, is to also go through these reports on Moodle, because they would be giving you historical background into how these things have developed over a period of time. Now, if I go into these reports briefly in some slides, what I would want to share with you is how we see how we see these bits coming across. So if I start with, say, for example, the beverage report, which is a report which was constituted in the 1940 in the year 1942. Now, this report, basically, these are the bits that it brought out, which are the main important bits of the report. So, one of the main efforts which Beveridge and his team did in terms of, creating this report was after World War II. Obviously, as you know, Britain, more or less, more some of the European countries were fully destroyed, including Britain. And what was acknowledged by the then coalition government was to look at that we need to rebuild Britain after the war. And in order to rebuild Britain, there are some bits of responsibilities which the government or the state would need to own. And these responsibilities essentially would be factored around certain basic amenities which the state would need to provide. And this was recognized in the Beveridge report. So he and his team created a set of detailed proposals which led to the comprehensive social insurance system that we see in some shape or form, and the shaping of the social policy that is available today in the UK. Now, this report, when he looked at rebuilding Britain, and he proposed this, that how would the government and how would we go about rebuilding Britain after World War II, he basically identified these five giants, as he called them in his report. These five giants were that the government needs to essentially, take a handle, control them. And because after the World War II, there was excessive, say, for example, in Britain, when we look at in particular, there was excessive disease, there was ignorance, there was squalor, there was idleness, there was no jobs, and there was definitely a need to create growth and obviously restart the economy. So what he said was these five giants that he identified in the recommendations in his report included that the government would need to take ownership of the education, the families, the health service in the UK. The government will also need to provide some sort of an insurance to people who are without jobs, cannot work, or are war widows, or, in that particular situation, at that point in time, the situation was that a lot of men had been killed. Women and children were needing support in terms of allowances. So, National Insurance Act. And then in some cases, he suggested that people who have been left, or children who have been left without parents, so he looked at creating a Children's Welfare Act that allowed the local authorities to take up some of these responsibilities of bringing foster children up in the society. So these five major changes which he suggested, when I say changes, these were five major points that he suggested, which he strongly recommended to the government to own and provide these, facilities to the citizens of the country, are actually outlined in the Beveridge report. So these, at some point in time, after the publishing of the report, the coalition government at that point in time ended up creating these five acts which were passed in the parliament. So the Education Act of 1944 was created, which basically looked at providing free secondary education to all children. The Family Allowance Act of 1945, which basically provided universal benefit for families wherein they had more than two children. Things what we get to see in today's modern system of universal credit. We see the beginnings of that happening from the family allowance in 1945. For example, if you're married, you're a couple, you get some sort of a family allowance or a discount on rebate. Let me not put it this way: discount. You get a rebate on your income tax if you have a certain income as a husband and wife, and you have children earning up to 28,000. You are eligible, or up to 33,000. You're eligible for some tax rebates. Then this also led to the creation of National Health Service Act of 1946. At that point in time, the NHS was not established. So we'll go to the establishment of NHS, but the National Health Service Act was set up in 1946, which basically guaranteed that all citizens of UK would be provided free and universal healthcare. That means they would be able to get care, any sort of care which is required in terms of social care, clinical care, mental health care under this particular act. Then it also established the National Insurance Act in 1946, which basically provided social benefits to people who were on, say, for example, who were not able to work because of not enough employment opportunities being there, or in some cases, could not work because of their disabilities and sickness conditions. Then in those cases, this particular act allowed the government to provide benefits or basic minimum sustenance means to the citizens of the country. And the last act was the Children's Act of 1946, which gave local authorities the responsibility to be able to set up social work, services for children. So these five major developments, which led to a lot of further acts and legislations being introduced in the UK, and in some shape or form are related to the National Health Service that we see today, were all are going to see the beginnings of from the recommendations and the let's say the findings and the recommendations of the Beveridge Report of 1942. Now, the report, if you read, basically covers a lot of different acts, and there are links on the Moodle which I put in to the Beveridge Report, which is I think on the website King's Fund, and there are some hyperlinks in certain places in that report which will allow you to go and read further into some of these recommendations which at that point in time were created. Now, when we look at the formation of the National Health Service, NHS, this came about on 5th July 1948. So the National Health Service Act of 1946 led to the creation of NHS, as we call it, and the full form of NHS is National Health Service. And this is when we say the birth date of NHS is in the UK. So if somebody is to go back and ask you a question that when was NHS formed, 5th July 1948 is the date on which the NHS was essentially formed. Now, when it was formed, it has basic principles or guidelines which were given, and these basic principles and guidelines basically meant that at that point in time, majority of doctors at that point in time when the NHS was being formed were opposed of the idea that a national service would lose more money in terms of taxpayer, would be inefficient, and will be too big an organization to manage and work and provide these services to the citizens of the country. But as the NHS started to take shape, and obviously, government started to, firm up policies, procedures, and pour money into the NHS as an organization, what we do get to see is that some of the acts and schemes which were essentially helping on the periphery to establish the NHS were actually amalgamated, and they were all they all seamlessly integrated into the scheme to be able to run this as a national body. Now, when we look at before, and because we have to look at before and after, compare and contrast, which is there in one of the tasks. So what we want to understand is what was there before the NHS? How was the medical services provided before the NHS was formed? So before the NHS was formed, there were GPs, which were family-led practices, and they charged for this particular service when people went to the doctors to be able to get a diagnosis, or go in to see the doctor for illness, for any sort of diagnosis and things like that. So this part of the service was being paid for by the patient or you and me privately, and up until the formation of the NHS in 1948, if you fell ill or you needed to see a doctor, You would go and see the doctor or a surgery or somebody as a doctor in a shop, wherein it would be termed as a surgery. And what you will do is you'll pay for the visit, you'll pay for the diagnosis, and you'll also pay for the cost of the medication. So in some cases, this as a system was seen to be failing because not all people were able to afford this. Not all people were able to pay for this privately and get treatment or get diagnosis. So before 1948, you had to pay to go and see the doctor, and after 1948, these services were then provided through the NHS, and you had to go to relevant institution or GP surgeries or community centers in certain areas to be able to be seen by the GP or the doctor or the nurse, and then they would give you the prescription. Now, over the years, as these services have evolved, what has happened is that the government has started to appropriate funds to be deployed into NHS from the taxpayer. That means taxes that you and me pay directly contribute to funding of the NHS in terms of running and operations of the NHS. Now, I don't know in terms of how many of you've seen your council tax bill, but sometimes I think it'll be important to look at this detail. So my suggestion would be, when you get the yearly tax bill, from your council, there is normally a leaflet or a small booklet which comes along with the council tax bill, and that leaflet or that booklet is what I suggest you need to look at. I don't know how many of you have seen. So breakup of the council tax bill, say for Manchester City Council. I'm going to try and do a search to see if this is something I can show you. Now, I don't know how many of you know that this bill that we look at paying to the council every month has, what is called a breakup. And this breakup essentially helps run and provide for some of the services that we get to see being offered by our local bodies or our authorities. So there is a booklet which normally comes, and this booklet details out how your bill is spent, how the money that you pay to the council is actually spent by the council in terms of expenditure that they do in providing some of these basic services that we expect from the council to happen. Now, I've got one particular image that I've just randomly picked up from, say, for example, the website. Now, different councils obviously have a different way in terms of how they split the budget, but this is one such council, which is an image from a council's tax, which basically shows how the bill that you pay, say, assuming if you pay £100 every month as council tax bill, how that £100 is split up in terms of providing services. Now, part of the services that you get and the bill that we pay go into this, in terms of cost. So if we were to pay £100, £35 and 81 pennies of that goes into schools. The children that we have, and obviously they study in primary, secondary schools. So the council pays the bills in terms of running the schools from the money that we are paying to council as council tax. 34 pennies and 84 pence go, 34 pounds and 84 pennies actually go into social care. So part of your council tax bill that you pay, 30% or roughly 35% of that goes to schools, and 35% of that actually goes to, social care. Then there are bits and pieces which the government spends on roads, transport, and cycling, which is say 12%. Workforce, if there is people who are made redundant or need a job seekers allowance from the job center, 73p goes into that. Any sort of financial services, about 2%. Digital services, 1.5%. Transformation and communication, which is operational cost, 6.6%. Legal and democratic work, housing and community development is about 2%. So people who do not have a house or a roof over their head have been waiting or have been on the waiting list with the council to get a house, a council home. Then in those cases, council looks at building new homes or taking up new homes, for rental purposes to provide accommodation to members of public within that area, so that we don't have people sleeping on the street or, essentially people without a home. Then in those cases, 2% of that bill that you pay actually goes on housing. almost 3% of that goes into property planning and public protection. So that means all the public services, the properties which the government has, go into that. And similarly, regeneration is 0.37%, and any costs in terms of council tax reduction, exemptions, schemes, levies, or audits and borrowing cost. If the council is borrowing money, from hedge funds and others, then they also pay about 6% as interest costs, or, those bits are important. So when you get your council tax bill next time, my suggestion would be to go through that bill and have a look in terms of how much of that split goes into. So this is just a generic split, but in that split, because I've seen that bill a couple of times and I've gone through it, you have the fire services, you have the ambulance and emergency services, you have hospitals. So it will give you a detailed breakup of how much is the percentage of your council tax bill actually paying for these services that you pay to the council, and council in turn deploys that money that has been collected as council tax in funding these services which are being provided back to the community or back to the members of public in the country or in that particular town or in that city. So it will be an interesting read. Now, if we look at how things have progressed on in terms of funding the NHS. Now, 100% of the NHS funding comes from taxation. That means tax that you and me pay to the government, and the government then obviously deploys some part of that revenue which has been collected, generated through taxation, whether it's taxation on fuel or income tax or any other sort of tax, that the indirect or direct tax. The government then deputes that budget to the NHS, in terms of funding some of this for the services. Now, I don't know in terms of how many of you realize or have you done a particular bit of search, but if you look at what is the budget which the NHS has, on a year-on-year basis, if you look at some part of it in terms of budget and budget planning which the NHS gets from the government, what you need to do is maybe do a quick bit of search to see what is the NHS budget, in 2023 or 2022, and how much of that is something which the government spends in terms of providing these services, or funding these services from taxpayers' money. So if I look at the budget for 23-24, NHS budget stands at 168.8 billion. So if you haven't done this particular, search or are not aware of this statistics, my suggestion would be to look at doing a bit of search to understand that why this is almost like 1/6 or 1/7 of the spend of our government in terms of providing these services, the money which goes in, and why this is also sometimes a very big point during elections. Securing the NHS, reducing the waiting time with doctors in the NHS, reducing the waiting list of people waiting to get cancer treatment, hip replacement, heart surgery, or other type of surgeries, simply because a lot of us depend on the NHS for getting all the types of health and well-being services. So it becomes an important point during the course of elections as well with governments to say that they are looking at securing the NHS, increasing the hospitals, or making sure there are adequate staffing there for doctors, nurses, healthcare workers. And NHS is also the biggest employer in the country. So NHS employs over 1.4 million people, directly or indirectly, and these include doctors, nurses, healthcare workers, dentists, pharmacists, occupational therapists. You remember the last unit in which we looked at 350 different roles that are available in the NHS. So when we look at 1.4 million people working and NHS being the largest employer in the country, that is where we get a sense of how big this organization is and how dependent, and how the government needs to make sure that this organization runs efficiently, is well funded, and is well staffed, because every member of the public is actually dependent on getting all the services that we need for health and well-being, for mental health well-being, or any other type of services that we need, especially in health and social care. They all come from the NHS. Now, NHS from time to time has been looking at, obviously innovating, and when we look at certain types of things today, again, compare between today and what was present earlier. So there is some bits that I've included in this slide, that from time to time there are initiatives which are done. Now we pay for our dental costs, but in the past the dental costs were also covered within the NHS. We pay for certain costs, when you're between the age of 18 to 60, you pay certain costs, for example, for your eye test and other bits. But if you look at previously how these were maintained, so if I look at within the NHS, from time to time, there was budget set aside for providing free glasses or spectacles to, people if they needed it between the age of 2 and 16, wherein the, NHS services are totally free. So you don't even pay for your prescription charges for your children or people who are retired or over the age of 60. So there is no prescription charge. But if I look at going back and I compare this with how it used to work in the past, there was a charge introduced of 1 shilling, which is now roughly 5 pence, and a flat charge of £1 for dental treatments up until the NHS was formed. And after a few years, obviously this amount that is paid for prescriptions has slowly and gradually risen. I think it was £5 and 40 pennies. Then it came up to £7 and 20 pennies. Today, I think the charge is, about for prescriptions is about £10 and 40 pennies or £10 and 60 pennies, if I remember correctly. I haven't been to the surgery or I haven't taken any medications for God number, I don't know, 16, 17 years. So last I remember, the charge that you had to pay, a flat charge for prescriptions, was £7.20. And I think now that's gone up to 10 pound 40. Now, similarly for the NHS, when you have to go to the dental or dentistry to get treatments done, there's a standard charge of £16.50 that has risen now to £45 and 60 pennies if you want to go to a dentist and obviously get some of the basic things done. I think when we look at certain amount of charges that you have to pay when you go and see the dentist, or you get some procedures done, they tend to range, and that is where some of the prices are fixed, which is what you would need to pay to get these services. Now, when we look at some of these charges would differ. If I'm getting a tooth implant or if I'm getting something done, these charges would vary, and obviously they are to be paid for privately. So dentistry side of services, are totally private. If I look at the age group of 0 to 16 is free, but anything from 16 to 60, 65 or 60, 65 is, I think, paid for. Anything over that, you would need to pay a standard charge, but obviously some part of the treatment and services would be free for senior citizens or people who are retired. Now, if we look at how much the NHS was spending on these basic charges up until the 1950s was about 140 million. In 1950s, this charge costing the NHS rose to 358 million. So from 1940s to 1944 to 1950, this charge, almost these charges also almost doubled up from 140 to 358 million. Now, when we look at some of the changes which NHS has also gone through, what we also mentioned that some of the changes which we saw between the 1970s up until 1980s, when Margaret Thatcher era was essentially looking at privatizing, a lot of infrastructure in the UK. And this is where we see unions and trade unions and strikes and other bits happening. At that point in time, what we do get to see is that the NHS, when just like the country, went into a lot of financial troubles. So there was not enough money to be able to finance, some of the services being provided by the NHS. And the time frame between 1970s to 1980s was a time wherein a lot of these services, deteriorated. The quality of these services went down, and there was generally a lot of anger and frustration within the government and also within other public bodies which were working with the NHS, because there was not enough funding available to essentially run some of these services effectively. Then, when we talk about the second bit of important report that we mentioned, in the 1986, the Griffith report was introduced. And why this is important is because it looked at bringing on, some of the changes which were essentially required within the NHS and they were introduced. Obviously, the government commissioned a report, and this report, when it came out, basically created a consensus that the NHS needs to have a management, and the management of the NHS would then be given powers to be able to make decisions in terms of where the budget needs to be deployed, how they need to manage the budget, where they will look at, not spending or cutting the budget. And in some places, they would also decide that where is the surplus, and if it needs to be redeployed, then this will be deployed across areas which are deprived areas, and then prioritization of services would be done. So when we look at the Griffith report, what did it do in general when it was introduced to bring about the changes in the NHS? So imagine if it started on the 5th of July 1948, and these changes were then introduced into the system in 1986. What it did was it made a number of recommendations, and these recommendations was to give autonomy to the NHS by allowing the NHS to form a management structure, and this management structure would then be given clear guidelines and definitions to manage the functions of the National Health Service. And at no point in the management, of the NHS, they would be allowed to have generic people in the management, but the accountability part of it was also introduced into the management. So when we do talk about the Griffith report and its publication, and what were the bits that it helped in bringing as a transformation, within the NHS, what we generally see is that it allowed the NHS to become an independent body. It allowed the NHS to take grip into managing their own budgets, their own decision making, deployment of budget, and in some cases, it also allowed, with the primary focus of the report being that if there were challenges that and issues which were faced by the NHS, then the management of the NHS was made accountable for providing, deliverables towards those challenges and issues. So there was accountability which was brought in, and it was no longer that this would be decided by the Department of Health or by the government, but it was the management within the NHS which will have the primary focus to address these challenges and issues faced by, healthcare and social care services, and there would be a particular, focus on delivering these services to the elderly and vulnerable populations. That means people from ethnic and minority communities, and people who are elderly were, prioritized in terms of providing these services. Now, what we also see that during this time frame, the NHS transformed from what is called, independent hospitals, surgeries, and a system which was disconnected and working, but was disconnected, into what is called an organization of 57 major NHS trusts. That means where the hospitals and the primary care trusts and some of these independent institutions were brought together in terms of ownership and made together to work in tandem to have coordination to be able to provide and deliver these services for ensuring that integrated health and social care services are provided to the members of public. So the report focused also on reorganization of the NHS into trusts, which meant that it would have better coordination and integration between the health and social care services, and that would be effectively, hopefully, in the hope that it will provide more efficient and effective solutions and care to the individuals who require in a particular area. Now, the management and funding of it went into the hands of the NHS totally, and that meant that they were accountable. They were able to set their budgets. They were able to redeploy the budgets from certain areas wherein there were deficiencies to areas wherein deficit to certain areas in which there was surplus. And it meant that the management itself within the NHS was able to, take decisions to provide the best possible solutions to issues and problems that they were facing, both in terms of staffing and in terms of, funding. Then the Griffith report also, laid down some of the foundation for the role of local authorities. And that is where when we start to see the community cares concept being brought in. So although the community care concept, came into some sort of existence in the 1950s and 1960s as a result of developments which are happening, and the changes which were happening in the formation of the NHS. So when the Mental Health Care Act in 1959 was introduced, one of the key things which the government did was that it abolished the distinction between psychiatric and say for example the community care. And what it did was that it allowed all of this to be delivered through the NHS rather than having somebody to transfer from the NHS to a community care setup wherein they would receive some care. But this was all brought in under the NHS banner. So some of the community centers, care centers, psychiatric care centers, and other hospitals were all grouped into trusts. And depending on what the need was in that particular area, these services were then organized or reorganized to ensure that there is effective delivery to the members of public. Now, in the 1960s, what tended to happen was that what we get to see, the health minister, which was, the health minister at that point in time, Enoch, basically is also dubbed as the father of community care. He argued that mental hospitals were effectively prisons and they were preventing patients to return to normal life. So, what he did was he changed the concept that people would be admitted to mental hospitals and there are normal hospitals for surgical and other treatments. What he did was he basically said that these hospitals and mental hospitals, which were under a mental health care trust, were essentially effectively merged with the National Health Service. So all the hospitals and everything, in terms of any sort of care which was being given to the patient was all brought into under one trust under the National Health Service. There was no separate hospitals for mental health. There were no separate hospitals for procedures or surgical treatments or for accident and emergencies. They were all brought into under the ownership of the NHS. Now the Mental Health Act was refined in 1983, and this allowed that if people were admitted to hospitals for mental health conditions, then there was a legislation introduced which meant that if people were incapacitated, that means they do not have the ability to be able to make decisions themselves, then family members or somebody who is designated as a member from the family or by the court to essentially help make decisions in favor of the patient was allowed. And this allowed also people to appeal if they did not feel that the person making the decisions was making the decisions in favor of the patient, or the patient which was incapacitated in terms of not being able to make decisions because of say illness or terminal illness or whatever being the other reasons. So in such cases, the Mental Health Act allowed people to be admitted to hospitals but for mental health care, but here a designated person who was appointed by the court or in agreement with the court would then be looking at taking independent, advice, and then would make decisions in favor of the patient, whereby this would be in conjunction with the family members, the team which was involved in delivering the medical care, and also from a perspective of the patient itself. And that was a major change in the Mental Health Care Act. Now, when we look at the Griffiths report in detail, it also looks at making the role of local authorities more significant in planning and delivering of these services, specifically related to mental health care. So, when we talk about social services and include mental health services, one of the clear recommendations from the Griffith report was that it allowed, it basically, when I say allowed, it basically proposed to the government that local authorities should be given a more significant role in planning and delivering of social care services. It also stressed on the fact that when we look at the Health Act of 1983, it also stressed on the fact that the importance of involving service users, that means people like nurses, healthcare workers, doctors, consultants, GPs, pharmacists, occupational therapists, whosoever are involved in the delivery of these services to the patient, their role and their importance was stressed, that in the decision-making process, in order for the decisions to be right, correct, the decision-making process should involve the service users, it should involve the family members, and it should involve the patient who is essentially requiring this particular care so that it is benefiting the patient in terms of getting better. And one of the last bits it also recommended to the NHS and the government was that training and development should be made a part and parcel of the NHS constitution, wherein, or in this case, at the National Health Service. And this report called for making improvements in how training and development opportunities were provided to staff working in healthcare and in social services. So not it's not possible that at every time you are able to recruit people which have the knowledge and experience of working within a particular role. So that is where the stress in terms of focus in terms of training and development is there within the National Health Service, that continuous training needs to be provided, continuous development needs to be done in terms of trainings which are to be provided to staff or members of staff, so that they are able to have cutting edge skills which are required to be delivering services to patients in the time of their need. And the focus, because the accountability side of things went into the NHS, that would meant that the quality assurance side of things was made mandatory, that NHS at some point in time, would also need to ensure that the services, the quality of services that it provides, need to be adhering to certain standards. So the Griffith report essentially made recommendations to the government to establish mechanisms for quality assurance and accountability in the provision of care. And this is where we are going to see some part of this. I would say, I wouldn't probably directly link it to it, but I would say at some point in time, we would see the quality assurance side of things, in terms of, let's put it this way, let me rethink. So, quality assurance that we get to see, which is being delivered and maintained by CQC today, which is the Care Quality Commission. We see some parts of it, getting into some sort of motion. The things which led to the creation of CQC as a regulator, you know, we would see these things getting into motion after the Griffiths report, because there were a number of recommendations made by, Sir Roy Griffith to the government to say that the government needs to look into community care. It needs to have an inquiry into how this care is being delivered currently within the NHS. It also recommended, quality to be brought into the forefront of how these services and provision for care is essentially done. Focus on training and development, look at the involvement of the wider service team, which is involved in delivery of care to the patient, and then the role of authorities, local authorities, councils in general, to have a significant say in planning and delivering of these social services to the members of public. And finally, management and funding, which allowed NHS to own the whole process of providing care and the integration of health and social care services, so that more efficiency, productivity, and efficient care, which is related directly to the patient, could be offered through the National Health Service. So, if I look at in summary the Griffiths report, it made a number of recommendations, and these recommendations were then taken up by the government, and this led to the creation of general management structure within the NHS, and that allowed integration of health and social care services to happen, management and funding to decision on management funding to be taken internally, more closer working with local authorities, ensuring that users and family members and service users are involved in the care part of it, in the delivery of care part of it as well. And then, last but not the least, focus on training and development and quality assurance to bring accountability into the NHS and the functions of the NHS was the main outcomes of the Griffith report. So, if I quickly recollect, the Beveridge report set into motion some of the national acts that we get to see in some shape and form today, even before the formation of the NHS. And the Beveridge report focused on five major, things. The Griffith report, after the NHS was formed in 1948, and then after 40 years, say in 1980s, the Griffith report basically looked at reorganizing and suggested a lot of recommendations to the government to reorganize how the NHS essentially was working. And then when we look at, after this, we look at the Lord Darzai's report. So I don't know, in some of the cases, when you look at Lord Darzai's report, in terms of when this was brought across in 2008, what it basically did was, so if there were a couple of things that we basically say, that what was the report, why this was constituted as a field of study by the government, and how did it bring across some of the changes, which, let's put it this way, changes which were required further in the NHS. So after 1980s, you look at 90s, 2000, 2010, almost after 30 years, again, the government constituted an inquiry wherein Lord Darzai essentially then came across and, presented the recommendations of these findings from that report. Now, what his report essentially, said was that he suggested that, if I have to look at the summary of how Lord Darzai's report made a dent in terms of bringing across further modernization and changes into, the structure of the NHS, the changes were divided into, the recommendation that he made and his team made were actually divided into two main sections. One was that Lord Darzai recognized that in terms of providing care, the care that needs to be provided, he made a number of recommendations to, let's say, say that high quality care was high quality. The focus of NHS services should be on providing high quality care. And the second thing that he, within when I say high quality care, he also suggested that NHS should then put the values that it works with and the principles and values and beliefs that it works with into some sort of a constitution. So his report led to a consultation which later in 2010 led to the foundation of the NHS Constitution and the NHS Act of 2010. So his review and his recommendations, which were a series of report consultations that were done over a 10-year period. So obviously the report came out in 2008, but the work on this, started somewhere in the early 2000s. It basically looked at that as of then, the position of the NHS was that it needs to basically look at, focusing on high quality of care. It needs to develop a constitution which will be a constitution which will consist of all the NHS values, core values, principles, and belief. And at the same time, it will focus on, providing and putting quality at the heart of NHS. So the two sections of his report and the suggestions that have been made on high quality care for patient and the public, which is focusing on improving health as well as treating sickness through various procedures which the NHS and the NHS Trust take into account in terms of offering as services. And then the other side is giving the patient more rights and control over their own health. So in the treatments which patient get and in the options which patient get, they were given, he mentioned that the voice of the customer, that means the patient should be given choice in this case and control in terms of what choices they need to make to be able to take that treatment from the NHS. And on the other side, the second section of his report focused on how can quality be put at the heart of NHS. So he suggested a number of measures that would enable some of these standards to be raised although they were recognized as standards in terms of, okay, this is what the quality standard should be, or, this is what the delivery of the services should be to this standard. And this at some stage, when we talk about the quality to be put at the art of NHS, led to what is the creation of CQC in 2009 as an independent regulator, which was Care Quality Commission, being set up in 2009 to monitor the quality and delivery of these services by various NHS and NHS related organizations and trusts. So first section of the Lord Darzai's report focuses on, making sure that NHS is geared to provide high quality of care to patient and the members of public. Here, the focus was to improve the mental health being the improvement in terms of delivery of these healthcare services so that it helps in treating the overall sickness for which the patient is actually admitted into the hospital. And the second was giving patients more right and control over what decisions they make and how they make that decision by providing information to patients and empowering the patients to be able to take that decision. And the second part of his report focused on the quality part of it being put at the heart of NHS, which meant that the standards had to be raised, which were set in the previous years. And the other part was that the clinical involvement in terms of the doctors and GPs and consultants was to be increased in the decision making process by adding teams from this side into the management of the NHS. So doctors, positions like medical directors or people who were involved in, say, for example, strategic planning for the long-term plans of how, primary care would be provided through the NHS and what support that it would draw from local authorities and other agencies was being planned. And that is where the involvement of clinicians, that means people who carry out actual surgery or provide actual support, were included in the NHS management structure. So this led to the creation of, the NHS Constitution, and the Constitution has the key principles, values, and beliefs which the NHS works on. And I can put it this way that the first draft of what should be in the NHS Constitution actually came from Lord Darzai's reports and its finding. So the initial proposals and the first considerations which were done led to the creation of the NHS Act of 2010. And at a later stage, what we get to see that these being included in the NHS Constitution and the NHS Act, which were the things which the team of Lord Darzai and his findings in terms of consultations, reports presented in the year 2008. So if I go back to Beveridge report, the five main giants or the five main areas which were nationalized, then we go into the Griffiths report, which focuses on bringing management structure into the NHS, which focuses on the role of local authorities, let's say training and development and the quality of services and accountability being provided, then leading to the Lord Darzai's report to the creation of NHS Constitution and the Act of 2010 are all changes which are basically happening within the NHS to provide and modernize the, say, for example, the origins of community and social care, which is delivered through various channels within the National Health Service. Now, these bits is what you need to understand by going through the report, and that would give you a basic understanding of how do we see community and social care becoming important as an important part and parcel of the National Health Service. And at some stage when patients do receive treatment, at some stage they would then be provided social care, and they would say, for example, be needing community care, which would allow them to get better and obviously get back to their normal routine of how they carry out their activities on a day-to-day basis. And this part is very important. So when you look at studying the learning outcome 2, and it talks about understanding the development of social and community welfare provision. When we say the word development, well, we need to understand the historical developments which have happened, which have led to the formation of community care and social welfare provision that we get to see today, that we receive services from local authorities, the National Health Service, and any sort of, organization under the NHS. We get to see them today are actually all coming in from, what we need to do is basically understand how they were developed and how they came into being by understanding the historical developments related to the formation of let's say formation of social and community, provision. So that bit, is the essence of learning outcome 2. Is that clear? Any questions on this? Any questions that we have? Have you understood this, in detail?
Yes, please.
Yes, fine.
Okay. Now, what I will do is I will provide one particular handout which I'll upload today, and that would be Lord Darzai's report in terms of summary. So 4 reports are very important. If you understand these 4 reports, you are going to understand how the NHS came about, why is mental health care, social care, community care, primary care all a part and parcel of the NHS. And if you recall, a couple of years back, when Boris Johnson's government, when he came into power, he allocated some part of the budget which is within the NHS, and he said that the NHS every year needs to earmark budgets separately for mental health care services separately. So what he did was, when he was the Prime Minister, he basically provided an additional boost of £2 billion to start the mental health care services and make sure that within the NHS, whatever budget it gets from the government every year, it needs to keep aside a certain part of it to offer mental health care services to its patients or to members of public. And that is where the specific, let's say the provision of these budgets now is happening under the NHS. So going back a few years, obviously we talk about services which the National Health Service or NHS provides, but now because the aging population. So if we go back into some of the bits that we discussed in terms of what are the problems which developed countries are facing, when we see and talk about the aging population, in particular in the UK, some of the services that the NHS needs to now give budget for or split its budget into is services being provided to the elderly, services which are related to mental health services. So, spending into research or allocating for research when we look at new type of conditions which are coming up with the aging population, things like the Alzheimer's disease, dementia. When you look at these, there is a lot of care which is to be provided to the patient, and in such cases the mental health care services budget has to be kept separate from within the overall budget that the NHS receives for providing all the services. And that is what was constituted, by bringing in an act, again, revision to the Mental Health Care Act of 2008 to ensure that this budget is available separately and NHS is able to account for this, deploy this, and provide these services to the patient, requiring these services separately. So these bits are bits that you need to be, aware of. And the Marmot review that we discussed yesterday, there was a report which I uploaded, which is further something which the government looked at from a point of view of constituting a report and a community. And this report focuses on the community provision part of it. And the key focus is on this report is to underline and highlight the health inequalities in England in particular, and it provides evidence-based strategy to the government to say that why these inequalities are there and how the government and the NHS needs to go and address these inequalities. So, sorry, the Marmot review then focuses on providing 8 areas or principles as they are classified. And these 8 principles essentially classify that if there are slippages in these 8 areas, you would generally see inequalities being developed in providing healthcare services to the members of public. So these inequalities that the Marmot review, um, you know, looked into and provided recommendations to firm up policy or come up with new policy to the government was defined by Sir Michael Marmot in his report, and his team worked on this particular bit. So here they divided it into early years of development, employment opportunities, living standards, communities that people live up and grow up in terms of provision for healthcare in that particular community, role of discrimination and how it needs to be avoided when we talk about providing these services, and then what are the sustainability standards that the NHS needs to follow in terms of the environment to ensure that these facilities are provided to one and all within the country. So this report is also quite important because it actually did a lot of findings and consultations to basically look at unfolding of how social determinants of health essentially factors like income, education, social support which the people get from the council and local bodies actually determine the health of the individual, the and has, say for example, not determine the health, but determines the outcome of these services which the individual gets, from local authorities in a particular area. And this particular review puts into place that and recognizes for the first time that there are healthcare disparities which are based on the social economic status within the NHS as well. And they need to be eradicated or rooted out in order to ensure that the system is fair. So he came up with this concept of social determinants of health and mentioned that these health inequalities, if they are allowed to prosper, would create systematic differences in the health outcome of individuals in different population groups. So if I look at NHS England, NHS Wales, Northern Ireland, and Scotland, obviously there is devolved decision making allowed in terms of how the NHS works, and the management structure is allowed to make these decisions, to make adaptations depending on the population and the geography that they serve. But what he also predicted was that if we look at taking into account where people are growing up, where they are coming from, what kind of health facilities they get, what is the income level, and what is the education that they come and get in that area. This would also be affecting the health and overall well-being of the individuals at a later stage in life. And this is where we classify social determinants of health, and they become important factors when we take into account how one's health and well-being comes up if we take into account things like income, your education, and what kind of support you get from the local authorities, or support that you get because of your socio-economic status, and how does it bring out differentiated health outcomes when we talk about different population groups. So I gave you one example yesterday of, in certain cases, in certain cultures, the women only accompany the men or accompany women when they go into doctors or, seek advice from GPs. And sometimes this particular part of the diagnosis or the consultation typically also depends on what the family members think and, how they would react or how they would suggest the treatment to go through. And in those cases, what you would generally see is that the um, because of this cultural, let's say differences, they would the decision making and the treatment which individuals go undergo can bring out different health outcomes depending on which population group or ethnic background or culture you come from. So it was recognized in this framework or the report essentially that when we talk about fair society, when we talk about healthy lives, what we are looking at is that in order for this to happen, the Marmot review essentially gave clear guidelines to the government to firm up policies in 8 different areas to say that in order to eradicate and root out health inequalities, we need to ensure, the government needs to ensure that people are given the right amount of support during their early years of development. They are given opportunities for employment. The living standards that they enjoy should be, in some cases, the government should focus on the living standards within communities and should look at eradicating any sort of discrimination which can happen because of the socioeconomic status when people go into the NHS to receive healthcare services. So this report essentially further, looks into how the services within the NHS can be further, let's say, improved by removing health inequalities at the community and, at the community level for individuals. And that is where we see the concept of social determinants of health that we talk about came into being. And this is where, this report also is quite important. So this is what this report essentially, looked at, and the signature part of it, in terms of Marmot's review, is basically talking about the social determinants of, health. So these are the 4 reports which, if you understand and go into detail, will help you understand and develop, or understand the development of the formation of social and community welfare provision, which is related to learning outcome 2. Is that okay? Any questions on this? Now, if we have to go into specifics of the assessment criteria of learning outcome 2, the first one talks about key milestones in the advancement of social and community welfare provision. So here, there's a handout that I'd shared with you yesterday, which is up on Moodle as well, and that talks about policy timeline, critical developments in health, adult social care between 1948 to 2006. So what I've done is I've actually taken out a timeline from the table, which we have discussed, and this has been put into 3 tables here, and it gives you the clear milestones of major developments which have happened over the years, and how do we see, the advancement of social and community welfare provision happening within the UK. And it has led to the creation of lots of things. But if we look at the 5 major acts which were created, so the Education Act, the Health and Social Care Act, we look at the Mental Health Capacity Act, we look at the Universal Credit Act, and we also then look at some of the other acts, which is things in terms of the 4 reports which they've come across during different time frames. So when you look at the 1984, 84 or 86 report of Sir Roy Griffith, we look at Lord Darzy's report, which basically came out in 2006 or 2008, and we also look at the Beveridge report in the previous table, which led to the creation of, some of the basic services, and the formation of the NHS are all defined as milestones within this particular, chart. So this is a task wherein what you would need to do is go through this table and create a timeline according to various important milestones which have led to the provisioning of or creation of social and welfare provision within the UK. And 1960s to the Seaborn report of 1968 to 1980s would be very important, because that is where you would see most part of the social and community welfare provision being brought into some sort of fruition, or we see green shoots of it, being presented. And those are the major milestones that you need to mention. Now, if I have to summarize in my own terms, the table, and say that these are the various milestones, what I've done is I've done a bit of a comparison and contrast. So if I look at how the healthcare was in England in the Elizabethan era, so in 16th century, I look at, obviously this is the significant date, because on this date, the first laws in terms of how health and, services would be provided in England was passed during, that time frame. So basic sets of principles in terms of how the doctors, and at that point in time, there were no doctors, but obviously medical services were provided, were put into place. And what we see at that point in time, which was put into place in some shape or form, being taken into, account and then further being refined over the years in 1948 or 1946 when we see the NHS Act coming in. So something which is going back centuries, then looking at the major development of 1946, the Beveridge Report, then you look at the major acts which have been created, which are related to specifically health and social care sector. And I have summarized here from the table because I think these are significant developments which have led to the creation of, community welfare provision in the UK. So these acts, these milestones are significant, and that is what I've written in my own words by going through the table. For learning outcome or assessment criteria 2.2, it talks about comparing and contrasting the current health service with the previous years. So here, one of the ways to do this comparison would be to draw up a table and you look at key aspects of how services over the years can be compared. So I've taken out, 5 or 6 different areas like funding, access to care, range of services, quality of care, patient choice, technology, and collaboration. These are the areas in which I've compared and contrasted the services that we get today, and then we look at services, how they were delivered in the past. You could choose and create, say, for example, parameters which could be other than these. But essentially, when we talk about the NHS in general, we talk about funding, staffing, training, quality, services being delivered, types of services being delivered. So depending on whichever way you feel you want to classify and compare today's services or quality of services or funding of what the NHS get today with something in the past, maybe 10 years back, 20 years back, 30 years back, would be the comparison that you would need to do in order to complete this part of the task. So compare and contrast. How is, say, for example, if I look at prescription charges today, it's 1048, I think, I'm not too sure, but if I can do a quick Googling up, what are the prescription charges in England? What are the prescription charges in England? So if I look at the prescription charges in England today is 965 per item. So and if I look at say 10 years back, it was £7 and 20 pennies. If I go back a couple of years or a couple of decades, it was say 5 pennies or 1 shilling or 5 pennies. So when we look at the introduction of prescription charges, if I look at doing a bit of a comparison table on different things, so if I look at introduction of prescription charges when it was done, in England and Wales, in the NHS, that could be a compare and contrast that I look at, when was the introduction done. So in prescription charges were introduced back in the 1950s, and they were limited to, prescriptions in some cases, for example, that you had maximum of, say, for example, up to 1 shilling that you could give or was required to be provided. And in some cases, then at over the years, what has happened is that we've had a categorization that children do not pay, mothers on maternity leave do not pay, if you're on benefits, you do not pay. So these bits were introduced over the years, but the initial, let's say, origins of when the prescription charges were introduced in the NHS, they were first introduced in 1952. They were temporarily abolished in 1965, and then they were reintroduced in 1968 under budgetary pressures by the government. So if I look at comparing and contrasting, and if I do a new table here, I could do a compare and contrast in terms of some of the aspects that I go through when I go through these reports, and that would allow me to discuss say, for example, in this case, heads, and then I would say, what I would say is, say, the current services in health and social care and previous, say, provision of services. So this is current provision of healthcare current provision of services, because obviously we're talking healthcare, but we can delete that current provision of services and then previous provision of services. So if I go into, and maybe if I want to compare and contrast, I would say prescription charges. This is one of the bits that I want to discuss, prescription charges in the NHS. So when I talk about prescription charges, so here the current provision is £9 and 65 pennies. In the previous years, they were, say, for example, if I look at previous years and what were the charges, so previous years, about 10 years back, I think the charges were 720. Now, I might need to explain this in a bit of detail by writing a couple of words, and that would allow me to essentially explain how I'm comparing and contrasting the current healthcare services provision with the previous years of health and services provision. I can go into a bit of detailing here, and prescription charges in the NHS, I would say, were introduced in 1952. They were abolished in 1965 and reintroduced due to budgetary pressures say, for example, in 1968. Right? Then, if I want to look at another point in which I want to look at differentiation in terms of services, then I would basically take up a second point, which is depending on, how you would want to go through some of these reports. And when you go through some of these reports, you would come up with certain points that you would see that how these services were provided before, and what changes were recommended by the report, and what changes, when I say recommended by the report, so that will help you compare and contrast. Okay, these services were delivered like this, but after the report was tabled and the government accepted some of the recommendations of the report, this is what the change was brought in. So what you're doing is you're comparing and contrasting some of these changes. So I could also talk about, say, for example, the basis of, services which are given for dentistry. So obviously, up until 1950s, these services were actually free. There was a flat charge being charged, but for certain procedures, there was a flat charge of £43 or £198. But obviously, now this is totally more or less not funded by the NHS, and these services are to be paid for by the individuals, except for an age range of 0 to 16 during years of early years of child. And when you look at after being retired after the age of 60, then these services are free, but you are put onto a waiting list, and obviously these are then to be dealt and paid for by the taxpayer, in some cases subsidized by the taxpayer, in some cases paid for it privately. So in terms of these are the changes that you can compare and contrast when we talk about some how they are now currently present, and how they are currently, these services are currently being deployed and provided by the national service. Is that okay? So overall, what we need to do in this particular task is talk about what is the provision today and what was the provision a few years back, and that is what you would be looking at in this particular assessment criteria of, talking about healthcare services provision, which are basically in present times as against how they were provided in the previous years under the system. And this brings us to the end of Learning Outcome 2, wherein you are basically covering these two assessment criteria. Now, there's a bit of reading that you can do, which will allow you to understand, the bits that I've covered in detail today. So things, if when we look at in particular, comparison and contrast, you could look at reading this particular article on health and welfare, and then obviously one or two approaches which are written on blogs, why communities matter, why community care provision has become important in today's NHS. So obviously those are the bits that I would suggest that you would need to look at by reading these two articles. And then there is an article on, social care and support guides, which obviously talks about on the NHS website that how, social services are provided through various organizations, including charities, semi-government organizations. What are the various services included under social care? When we talk about care services in terms of care homes, care agencies, and things which would be related to how this care is delivered for children and for adults, and obviously how in some cases these services are related to community care services in general. So this is a good website, which is a good art, couple of articles which are on the NHS website that I would suggest that you can go ahead and read in order to understand social and community care services provision that we are, studying today. So let me just quickly show you that bit here. So this is the article that I'm referring to, which is the Social Care and Support Guide. So Introduction to Care and Support Provision, how it is being delivered currently using charities and various organizations, and what are the benefits to carers, what are the benefits to patients, and how decision making in this case essentially is done by the local authorities to be able to provide these services to the patient. So any questions so far? Any questions on today's discussion?
No, it's okay.
Okay, good stuff. So bit of reading to be done on Lord Darzai's report, which I'm going to upload. The Griffiths report was already mentioned yesterday, and there was also the Marmot review, which was uploaded yesterday. On the learning outcome 1. So what I'm going to do is basically just upload this here so that you are aware that this is something that you can read through. It's Unit 11 that we are doing. And in this case, what I'm going to do is, so this is where we have uploaded, where is it? So that's the handout that I wanted you to go through. This is the handout which shows the table, which I'll just show you right now. And if I look at, that's the Lord's Griffith report. And then I'm going to put the Marmot review. The Marmot review is also there somewhere. Okay. So I will upload the Marmot review now and the Lord Darzai's report. So this is the handout, sorry, this is the presentation. This is the handout which I was referring, from which I've taken the table of major developments and how you see, community and health social care provision coming into, existence within the NHS. That is one. Then we talk about these two reports, which I'm just going to move to learning outcome 2 because we've discussed them today. So if I look at the Marmot review, which was done yesterday, that is a detailed report, but I suggested that you go through chapter 1 and the executive summary, and then the Lord Darzai's summary report, which I've uploaded here, a couple of pages that I would suggest that you go through in detail because it is the summarized version of the report of the major recommendations made. Obviously, there are references here because it was a series of consultation and reports compiled by Lord Darzai, but some of them are available here as documents. But I would suggest to go through this document in detail in full. And then we talk about, so these two in particular, I would suggest that you need to go through along with the beverage report. And then the last one that we, when I talk about the Griffith report, I talk about so beverage report is something which is, is not a single document that I can provide. And beverage report is what I've summarized in my presentation slides that I would suggest you go through. So Darzai's, Marmot, and Griffith reports are here, but the beverage report is something which is a series of combinations of lots of things, and that is where it will be best read from the the slides of today. So hopefully this should be with you for reading. And my suggestion would be, if you think of any questions on today's session, feel free to come back to me, and I will be able to provide you additional documents or additional reading that you need to do so if you want to. and that would give you more information and knowledge into, how these reports were instrumental in essentially, providing some of, and, obviously creating some of these provision for services that we know today. So beverage report is quite a detailed report. This is the report on the UK Parliament website. This particular report, can be downloaded and can be read, but I would suggest that because it talks in detail about lots of different things, led to a creation of a lot of them. That is why, some part of it would be best read from the slides because there's too much to read in this particular report. And it was like a national policy program which was recommended by him to say that these are 5 things which the government needs to own, and that is why Britain is a welfare state. So when you look at education, medicine, housing, universal tax credit or benefits, those are all nationalized part of services, and 5 giants that he says that the government needs to slay is what are covered in this particular report. So my suggestion would be to go through some bits that we've discussed in Learning Outcome 1 yesterday and 2 today, a bit of reading, a bedside reading, and that would give you more constructive, information about when you go through the presentation and some of the handouts that are provided up on Moodle. And I will see you next week, wherein we'll cover Learning Outcome 3, which will then allow us to discuss the assignment brief for this unit as well on Sunday, next Sunday.
All right, thank you.
Are we not coming on Saturday? It will be Sunday, right?
Next Saturday will be Learning Outcome 3, and then Sunday
And then
will
the
be,
discussion.
the assignment brief discussion. Yes.
Okay.
All right, thank you very much.
Thank you.
Thank you.
One other, if you want to read the summary of it on Wikipedia, I think it is still outlined in summary in terms of what he proposed, and then there are links given here. So this would be one of the best areas that I've looked at to read and understand the beverage report, because it's too big, it's too broad. But you can get best parts of it from Wikipedia when you type beverage report.
Okay.
Beverage report. All right, thank you.
Okay, take care. Thank you.
All right.
Thank you.
Thank you.
Thank
Bye.
you. Bye-bye. Bye.